In this video, you guys can see that there's something on my leg. It's a cuff, and there's also like a piece of cloth as a sleeve lying underneath it so that cuff doesn't slip or fall off as I'm doing my workouts. Now, that cuff is a part of BFR training, BFR standing for blood flow restriction. And so this type of training modality uses that cuff to occlude venous blood flow from a limb, and it's also going to restrict arterial blood flow into that limb during low load resistance in order to mitigate muscle atrophy as well as enhance hypertrophic responses. So in essence, and all of what that means is essentially using the BFR, that cuff on my leg, it's going to stop the blood flow from my leg going back towards my heart. Veins carrying the blood flow, deoxygenated blood back to the heart. It's going to stop that coming from my leg. It's also going to restrict blood flow from my heart going towards my leg. So from the arteries carry blood away from the heart, going back into that leg. And so that cuff that I'm wearing, it's connected to a piece of device that's going to personalize the pressure that should be on my leg. Safe for me to use and also challenging. And so what that does, it's going to stop that blood flow during my low load resistance training. And why is it doing that? So as many of you guys have found during my ACL recovery process, especially this last one, there's a lot of restrictions. And the reason for that, because during the surgery, there's a lot of work done. And so you need to allow for enough time for the tissues inside my body to heal properly. So even if I look okay or maybe feel okay on the outside, on the inside, there's still a lot of protocols that need to be met before I'm able to do certain activities. And the big thing with that being is the amount of weight, the load, the intensity at which I'm training. It needs to be very restricted in the beginning to make sure that my ACL recovers properly and it's in a good timeline, as well as my meniscus that I damage, as well as the LET, lateral extra-articular tenodesis, which I had the incision on the outside of my leg, as well as the MFC osteochondral allograft that I had as like that bone plug for my leg. So I had a lot of different things that made me where I was unable to put pressure on my leg for over 2 months. And so when I was doing my trainings, if you have also seen other videos when I was non-weight bearing and couldn't put pressure on my leg, I did use the BFR as well to do things like curls, quad sets, and things like that, where I couldn't physically put that weight on me, but by allowing the BFR to kind of assimilate that effect of intensity during that workout. So essentially during that low load resistance training with the BFR, I'm roughly using 20% or less of a load of my normal 1 rep max, right? And usually when you're trying to train for hypertrophy or strength, you're looking at going over 70% of a 1 rep max, or if you're going 30 to 40% and you're going until failure. Clearly none of that, which I could do, but during this specific phase, during the rehab process, by using a load that's less than 20% of what I'm able to do and using the BFR, studies have shown that the responses are very similar. So in essence, what that means is during these initial stages, during the recovery process, where I'm not allowed to do much, I can make sure that I try to save as much muscle in my leg and actually put on muscle mass, which I would not be able to do with just the body weights that I normally would be okayed or cleared to do. And so this is imperative in those first stages when I'm not allowed to do a lot, that if I want to maintain and actually instead of just maintaining but build up on the muscle mass that I have in that leg, gain strength and range of motion in that, the BFR training is essential. This makes something that would be relatively easy extremely hard. And so when I'm doing that leg press or the RDLs, even though I'm using body weight or maybe like 5-10 pounds, not a lot of weight, it seems that I'm lifting like hundreds of pounds. It's extremely hard. If you guys have never used it before, it's definitely harder than it looks. Now, with that being said, this is a very good modality to use for training when it comes to the recovery process, the rehabilitation process. So after surgery and recovering from things like that, or if you had an injury and you had a lot of muscle atrophy, trying to regain that without putting stress on the connective tissue like the ligaments and tendons in your body or any other tissues that would be in harm of getting injured from going too high, too fast, progressing too fast, really, with those tissues would be able to do. Now, what I'm not saying is for you guys watching this video and you're like, oh my gosh, let me do this because I want to get bigger, stronger, faster, whatever. It's not necessarily going to be as optimal for just an average individual who doesn't have any injury that is just trying to drop their high load, high intensity training and switch it in for BFR training, doing lightweight. Because once again, when you are using the BFR, you are using lightweight, 20% or less of your 1 rep max there. And so if you are able to hit loads of 70% or above, I would way rather stick to that. But in the process, when you are limited, when you're restricted, when you're not cleared to do certain activities, then the BFR is very beneficial. And honestly, I think optimal when it comes to the recovery process post ACL surgery or post other surgeries and injuries, because when you are limited and you can't do something, this gives you the resource to try and be similar to the type of training style that you would be normally able to do, or the goal that you're trying to do in a couple months. So once again, the BFR, blood flow restriction, this is that cuff that you guys saw on my leg. It had that sleeve underneath, once again, so it doesn't slip off. That's why when sometimes you see the videos, when you look at my leg, it looks a little purple or red, depending on what time you're looking at that, because of the blood flow restriction in that. You can really see that when you compare it to my right leg. And it's kind of cool too, because if you look at the scars on my leg get really dark when it is on that BFR thing. And it shows you, that your blood is being restricted, that's being pulled in here. And then when you take it off, it's kind of released again. So hopefully this answered your question. If you guys have any other questions about the ACL recovery process, feel free to leave a comment below. And remember, as always, this process is a long one, so stay patient, keep on putting in that work, and it's going to pay off.